Now we are going to see some non-ultrasound screen tests we can do to screen for aneuploidy and other invasive tests we do during pregnancy. So, gestational age at which we do cell-free DNA, which this procedure we reviewed in the previous video. This is at 10 weeks gestation. Chorionic villus sampling, this is at 10 to 12 or 13 weeks gestation. Amniocentesis, this is done between 15 to 17 or 20 weeks gestation. Percutaneous umbilical blood sampling, this is done after 20 weeks gestation. And fetoscopy also is done after 20 weeks gestation. So, in which trimester are we going to do cell-free DNA test? If we are going to do so, this is during the first trimester. Chorionic villus sampling is also in the first trimester, 10 to 12 weeks gestation. Amniocentesis, this is in the second trimester. And percutaneous blood sampling and fetoscopy, which is after 20 weeks. So this means this can be done during the second or third trimester. But we usually do it as soon as possible. Then the procedure itself, cell-free DNA. This procedure is we are going to draw blood from the mother, and we are going to isolate the free DNA of the fetus that could be hanging around there in the maternal blood, free DNA of the fetus. Chorionic villus sampling, this is we insert a catheter under US guidance, and we are going to aspirate placental tissue. And this is done via transvaginal or transabdominal, or transabdominal. And so we insert a catheter all the way to where the placenta is inserted, and we aspirate chorionic tissue, which is placental tissue. But we are not going to touch the fetus. The catheter does not enter to the membranes, as opposed to amniocentesis, which is we insert a transabdominal catheter, again under US guidance, and here we are going to aspirate amniocytes, which are cells from the fetus that are hanging around in the amniotic fluid. Then percutaneous umbilical blood sampling, this is we draw blood from the umbilical vein, and fetoscopy, this is done in the operating room. These ones can be done on a clinic. This needs to be in the operating room under general anesthesia. And here we use a fiber optic. So this is a transabdominal procedure, abdominal procedure, and we use a fiber optic to visualize the fetus and the structures. So, advantage of cell-free DNA. The advantage is that this is a non-invasive test. Non-invasive test that we can use to screen for aneuploidies. Chorionic villus sampling advantage is that in this case that we are going to screen for aneuploidy, this is going to be a genetic test. Amniocentesis, this is also going to be a genetic test for aneuploidy. Genetic test. And comparing chorionic villus sampling with amniocentesis, chorionic villus sampling can be done before amniocentesis. This is done in the first trimester, this is done in the second trimester. But amniocentesis, this even though is done in the second trimester, here or usually here we can evaluate for alpha fetoprotein, which is produced by the fetus, but instead of measuring the amount of alpha fetoprotein in maternal blood, is more sensitive to do it in cells of the fetus. So here we evaluate for alpha fetoprotein, which is more sensitive than the lab test we do from the mother blood. Then percutaneous umbilical blood sampling. Advantage is here we can do a transfusion. For example, in cases of anemia, and we can evaluate for blood gas. We can do a blood gas analysis, and if we wish, we could also do a genetic test, a karyotype testing. But most of the time, if we are going to do a genetic test, we are not going to do a percutaneous umbilical blood sampling. This is more for blood gas analysis or transfusion. And fetoscopy, the advantage is that in this case we can do surgeries. Then disadvantage of cell-free DNA is that we could have very low concentration of free DNA, of fetal free DNA in maternal bloodstream. Chorionic villus sampling disadvantage is that we can have rupture of membrane each time we insert a catheter or a needle or whatever into the uterus, that can irritate the uterus and predispose to premature rupture of membranes. We could also have hemorrhage, which is low. Amniocentesis disadvantage. We can get chorioamnionitis, maternal or fetal hemorrhage, and the risk of baby loss, which is pregnancy loss rate. Here pregnancy loss rate is around 0.5%. Here is 0.7%. And also, as we are inserting a needle in the uterine cavity, we can also have premature rupture of membrane. premature rupture of membrane. Percutaneous umbilical blood sampling is one disadvantage, is 1 to 2% rate of fetal loss. Because here we are touching the umbilical vein, and the blood that the baby is receiving is from the umbilical vein. So this has a higher rate of pregnancy loss. And fetoscopy, this one has the highest risk of pregnancy loss, which is from 2 to 5%. So here, more advantage and disadvantage is comparing cell-free DNA with chorionic villus sampling with amniocentesis, which are the tests we use to evaluate for aneuploidy, or one of the tests we can use to evaluate for aneuploidy. Obviously, this one is going to have advantage or disadvantage. Advantage is we can do transfusion, but we have a high rate of pregnancy loss. But these are procedures that sometimes we need to do. These are like independent. Here, more advantage and disadvantage is comparing these three. And also the reason for doing amniocentesis between 15 to 20 weeks is that if we do amniocentesis when we have low amniotic fluid, then there is an increased risk of pregnancy loss. So for that, amniocentesis is done between 15 to 20 weeks gestation. Also chorionic villus, also amniocentesis is associated with limb defect if the test is done before 9 weeks gestation. Something that does not happen with amniocentesis, but because normally amniocentesis is done between 15 to 20 weeks. So if we do chorionic villus sampling before 10 weeks, it's associated with limb defects, and as opposed to amniocentesis, when we can evaluate for alpha-fetoprotein, which is to evaluate for neural tube defects. Here in chorionic villus sampling, we cannot evaluate for neural tube defects. As opposed to amniocentesis, which can evaluate neural tube defects. And indications, cell-free DNA is done. This is the earliest screen for aneuploidy we can do, but normally this is done after quadruple screen. For example, for aneuploidy, which we saw in the previous video, which is done between just maternal serum alpha-fetoprotein, that is done between 15 to 20 weeks. But also the quadruple screen is done 15 to 20 weeks. There are also some tests we can do between 10 to 14 weeks, for example, pregnancy associated plasma protein. But normally the cell-free DNA is done after quadruple screen and after anatomic ultrasound sometimes. So indications would be having an abnormal quadruple screen test, or having an ultrasound with findings of aneuploidy, or if maternal age is greater than 35 years, or in the case that we know that the mother or the father has a Robertsonian translocation. even though if this test is positive, we need to confirm the test with chorionic villus sampling. So indication is confirmation of cell-free DNA testing, or we confirm the cell-free DNA test with amniocentesis. So indications for amniocentesis: confirmation of cell-free DNA test. But normally amniocentesis we do it when we want to evaluate for aneuploidy, even though we haven't done cell-free DNA test. It's rare that we do cell-free DNA test. Also with amniocentesis, for example, if the mother has more than 35 years old. Percutaneous umbilical blood sampling indications: analyzing blood gas, or if we want to do a transfusion because of anemia. Fetoscopy indications is here we can do surgery. So advantages, we can do surgery or skin biopsy. So indications would be surgery, for example, when we want to burn the vessels that communicate one fetus with the other in a twin pregnancy, because we are having twin transfusion, which we are going to see in the next video. If we have twin transfusion, we want to burn the vessels that are communicating one baby with the other. So laser surgery for twin transfusion, or for example, if we need a skin biopsy for fetal ichthyosidosis, which is a condition where the fetus has a very hard skin. So cell-free DNA, chorionic villus sampling, and amniocentesis. These tests are done for aneuploidy. The main advantage for cell-free DNA is that it's not invasive, but disadvantage is that it's not karyotype testing, where it's not a genetic test, as opposed to chorionic villus sampling and amniocentesis, which is a genetic test. But as we are inserting a needle, we always have risk of pregnancy loss, rupture of membrane, hemorrhage, infection. Here we also have risk of hemorrhage, infection, the rupture of membrane. Each time we insert a needle or something, here we are inserting the fiber optic, which has higher diameter than a needle. So here we have more risk of pregnancy loss. Pregnancy loss with cell-free DNA test is zero because it's not an invasive test. Here we are drawing blood from the mother. Pregnancy loss with fetoscopy is the highest, 2 to 5%, which is some procedures sometimes we do. But just concerning aneuploidy, the highest rate of pregnancy loss is with chorionic villus sampling, but this is done before amniocentesis, which has a pregnancy loss rate of 0.5%.